Restorative and Crowns, your post-treatment guide. Hey there, Dr. Derek Dean here from Ruby Canyon Dental. First and foremost, thank you for entrusting us with your dental care. After dental restorations, such as fillings or crowns, there are a few things you should know and expect. Let's review them now. Dealing with sensitivity. Experiencing sensitivity, especially to cold, is completely normal for the first few days after your procedure, and it can last for a few weeks. Working on a tooth can be irritating to the nerve. It is often helpful to look at the trend of the sensitivity so we know what to do. If it is getting better, then it may just need a little bit more time. Using a sensitive toothpaste can often help. If it starts to get worse, it can be a sign that the nerve is not healing as expected. Please call or text us if this is the case. Sore gums? Here's a solution. Your gums may be sore after your treatment. Many people find relief by rinsing with warm salt water. Just add half a teaspoon of salt to a cup of warm water. Salt water rinses can provide relief and promote healing. Managing discomfort. We recommend taking over-the-counter pain medications such as Ibuprofen and Tylenol as needed for pain or discomfort. Eating post-treatment. Please be careful when eating after your procedure. Since your cheek, lip, and tongue might still be numb from the local anesthesia, it is easy to bite them and cause harm without knowing it. This occurred with my son after a simple filling. His tooth and gums were fine from the procedure, but his lip was really sore and swollen from accidentally biting himself. If possible, wait until the numbness has worn off before eating. About your bite. Speaking of biting, we've made adjustments to ensure your bite is correct. However, people often bite a little different when they are numb. Once the numbness wears off, if things don't feel quite right, please don't hesitate to call or text us. A simple adjustment is quick and easy and can make a big difference. Special note for temporarily cemented crowns or veneers. If your crown or veneer was temporarily cemented, please be mindful of your food choices. Avoiding sticky or chewy foods can prevent the crown or veneer from becoming dislodged. Also avoid flossing around the temporarily cemented crown. Should your crown or veneer come off, please call or text us so we can discuss how to manage it. Thank you for trusting us with your care. If you have any questions or concerns, please call or text us at 970-241-1313. We're here to help.